our questions. Here in DC, we're within 30 minutes of 7 hospitals and a lot of amazing providers, right? In my district, however, in New Mexico, which you know, my beautiful district, expectant moms from my hometown, Las Vegas, New Mexico, they have to drive an hour if they want to give birth with a doctor. In Gallup, on the Navajo Nation, 42,000 Native Americans will receive trauma care at the Gallup Indian Medical Center, which is the only trauma care center within a 150-mile radius. And this is what healthcare looks like in rural America. This is what healthcare looks like in rural New Mexico. And while we have a lot of amazing doctors and nurses, we simply don't have enough. And I really want to thank you and the administration for putting forth a budget that has mandatory funding for the IHS. I just came from a natural resources hearing. I am the chair of the Subcommittee on Indigenous People. We were honoring Dean Young, and this was a passion of his, and I am hoping that we will get this through with bipartisan support, recognizing this as indeed his legacy. But I want to talk about the general need for all of us in rural America. What is the IHHS doing to expand access to care in rural and tribal communities in the short and long term, especially coming out of COVID, which laid that devastating light on the number of deaths and devastation because there wasn't enough care?
Congresswoman, thank you for the question. And by the way, it really is a beautiful district that you have. One of my dearest friends, my roommate for 4 years in college, lives in Las Vegas. And if I can just really quickly mention, when we first met freshman year, he asked me where I was from, Sacramento, California. Well, I told him I'm sort of from a suburb of it. And then I asked him, where is he from? He said, well, I'm from Mora. He said, well, I'm really not from Mora. I'm from a suburb of Mora called Ladue. And when I finally had a chance to see his home of Ladue, it was a cluster of a few homes, and it's what you have in New Mexico. It's a beautiful place. To your question, this budget is a groundbreaker when it comes to IHS funding in Indian country. We are asking you to move towards mandatory funding for healthcare services in IHS, something that's going to be for the first time available if you pass this, so that health centers in Indian country don't suffer the consequences of a breakdown in budgeting authority here, where you may have an impasse and not get monies across. If it's based on discretionary funding and you don't pass a budget, they get no money. All the other health centers do because it's mandatory funding. We also call for advance appropriations, which means they can project how much they'll have, so they can project what they'll be able to do.
Right, so the IHS I'm great on. I love the fact that you're doing that. I wanted to focus a bit on the rest of rural America with regards to getting providers there, getting them on the ground. And if you could answer that quickly, because I wanted to also talk about the Social Vulnerability Index.
We have a major focus on rural communities. Obviously, the Provider Relief Fund, we were able to drive additional dollars into rural health providers. We are going to continue to seek out more authorities for telehealth services because so many members in the rural communities rely on telehealth today to receive their services. So we'll work with you to make sure we're getting good care, quality care to people in rural communities.
Well, thank you. And I want to also then turn to something else that affects rural communities, which is the Social Vulnerability Index, which, as you know, measures factors like poverty, car access, et cetera. The federal government has distributed COVID-19 resources, as I understand it, mostly by population to the states. But if the agency used instead the Social Vulnerability Index, vulnerable communities in rural Mexico and other parts of the country might get those medications especially quicker and other resources. And I ask this because I know that you have an equity index, but maybe not a vulnerability index. And when there isn't enough nearby care, that's a problem. I was wondering if you could address that.
We have funds beyond those that are distributed by formula that let us target areas that are in real need. And that's how we're able to go into some of these communities above and beyond what would otherwise come based on a formula.
Well, thank you, Secretary. My time is up, but I will say I'd love to work with you because I am hearing that they're not getting the resources. So let's work together.
Look forward.
I yield back.
Thank you. A gentleman from Wisconsin, Mr. Fitzgerald. Thank you, Mr. Chair. Thank you, Mr. Secretary, for being here. Mr. Secretary, during your time as AG of California, you sued the